Well, we are all eagerly awaiting a COVID-19 vaccine, but what goes into developing one and how do scientists know it's safe? Well, joining us now is Dr. Jeff Pothof from UW Health System. He's the Chief Quality Officer. Thank you, Dr. Pothof, for being with us this afternoon.
Good to be here. Thanks.
Yes. Well, first of all, doctor, how are vaccines tested and approved? A lot of people wonder, this has been a rush and a lot of companies are sort of like at the end phases. Can you give us a little bit of a rundown on how that happens?
Yeah, so the process to develop a vaccine is actually pretty complex. At first, there's going to be a preclinical phase, and this is where they test the concept on, animals that are probably not human. They try to make sure, it's safe. Can we give it to humans? After that, they do a phase 1 trial. These are very small trials in humans, and the goal is to make sure that it's safe, that those small group of humans don't have really adverse side effects. The medication or the vaccine appears to be safe. From there, they go to phase 2 trials. And in addition to safety, now they're trying to figure out what dosage do I need? We don't want to give too much. We don't want to give too little. They figure that out in phase 2. And then the most robust phase is phase 3. And that's what you're hearing about now. Phase 3 is where we thousands of people, and we can identify very rare side effects that the vaccine might have, but we can also determine, is it effective? Does it actually prevent people from getting COVID-19? Once it passes those phases, it'll get FDA approval. They'll submit it for approval. And then we'll be on to the process of trying to vaccinate, hundreds of millions of people so they no longer have to worry about getting the coronavirus.
So it does go through a lot of testing. Doctor, can you tell people just how important vaccines like polio, vaccines for polio and measles and chickenpox, how important have those been to public health in general?
I would say vaccines are the most important thing that modern medicine has designed. Before vaccines, thousands of people would die of diseases that now are largely unheard of, whether it's smallpox or polio. These diseases have been essentially wiped out with the creation of vaccines. So an extremely powerful tool that keeps us from getting diseases that otherwise we'd really have no defense against.
Yeah, they've been very crucial. Could you tell us what would be your earliest estimate as to when we might have a reliable vaccine for COVID-19, doctor?
With phase 3 trials starting now and ongoing right now, and I think with the idea that manufacturers are making the vaccine before we even know if it works, it's possible that we may have a safe and effective vaccine early sometime next year.
Well, that sounds good, and that's music to a lot of people's ears. Dr. Jeff Pothof, UW Health System, we appreciate you being with us and shedding light on a possible vaccine coming up for COVID-19. Thank you, sir.
Thank you.